Today we're going to talk a little bit about caring your pet who may be going blind. Sometimes this comes on slowly and you notice that when it's darker your pet can't catch a treat, or maybe your cat can't quite jump on a chair in the evening, but in bright sunlight they're able to do the normal things. You might notice bumping into walls, or you may see sudden changes in the eye, discharge, swelling, pain, squinting, something like that. Regardless of what you see going on with your pet's eyes or their behavior, it's probably a good idea to take them to the vet. There are some conditions that the sooner they're caught, the better they can be treated. For example, cats with high blood pressure can have retinal detachment and lose the ability to see. If that's caught early in the first couple of days, proper treatment can actually reverse and the retina can reattach. There are other conditions like ulcerations of the eye, scratches, trauma, that the sooner you catch it, the better chance of saving the eye, whereas if it goes too long, we may actually lose the eyeball and vision. There are other conditions like sudden acquired retinal degeneration syndrome, which comes from lifetime of allergies to different things. And it's just slow and progressive, and first your dog can't catch treats and then bumping into things and things get worse and worse. This is the sort of thing that when you go to the regular veterinarian, it's really difficult to diagnose in the office. This is when it's great to go to a veterinary ophthalmologist. Specialists are specialists for a reason. They have tools that most of us as general practitioners don't have. Eyes are very special and sensitive, and just like humans, we have special tools to evaluate what's going on with the eyes. Cataracts also really need special light to see what's going on. Once your pet's been diagnosed, and if the blindness is irreversible, the important thing is quality of life. So what can you do for good quality of life? First, don't move the furniture around a lot. They learn their way, they're able to see with the rest of their body how things are going. Don't give a lot of guidance. They need to learn to find their way. If you're constantly leading and showing for them and not letting them think for themselves, then their brain isn't able to adapt and to make the changes. An interesting thing is that alternative therapies can sometimes help. While it may not restore vision, what alternative therapies do is make the body work better, make the brain work better, so that then the brain can process and see, and figuratively, of course, see what's going on to help adapt to a new situation. So the dog that's feeling great and the cat that doesn't have any other issues other than blindness can adapt and still jump on chairs if they know exactly where that chair is. And then the other thing that I love to talk about is great food. If a lifetime of allergies can lead to acquired retinal degeneration syndrome, then the best food we can feed and no allergies is very likely to prevent retinal degeneration. It can be scary when our pets lose our vision, just as it is for ourselves. There are things that we can do if we catch it early, and once the vision is lost, again, there are things that we can do to keep our pets comfortable. This is Dr. Cathy, and thank you for joining me.